Hello, my name is Maslin Smith. I'm a student nurse at the University of South Alabama College of Nursing, and today I'm performing a tracheostomy, suctioning, and care checkoff. Okay, so the first thing I'm going to do when I walk into the room is perform hand hygiene, and I'm going to make sure I have all my supplies ready as well. I'm going to greet the patient, so I would just tell them, hello, my name is Maslin Smith. I'm a student nurse at the USA College of Nursing, and today I'm going to be performing a tracheostomy, suctioning, and care, if that's okay. Okay, so when I've got all my supplies together, I'm going to make sure I have my thing close to the bed. I'm going to move my trash can. And I'm performing hand hygiene after I touch the trash can. I'm going to check my saline. I'm checking my supplies, and it is in date, so I can use it. The next thing I'm going to do is I'm going to check the medical order, and I'm going to follow hospital policy. Okay, so the order is, let's see, suctioning, tracheostomy is needed, so number 9, and then number 10, routine trach care. Okay, so the next thing I'm going to do is check the 2 patient identifiers. So it is wristband, so Jaguar Jones, the date of birth, 08/25/1963, 08/25/1963. I'm also going to check for allergies at this time, so allergy to aspirin and allergy to aspirin. I'm also going to ask Mr. Jones if he has any extra allergies that were not listed in the medical order as well. Okay. So after that, I'm going to provide privacy for the patient. Perform hand hygiene once again. I'm going to lift the bed to a working height. And I'm going to put the head of the bed at high Fowlers or semi-Fowlers, which is about 45 degrees. And I'll lower this side right. Okay. So the next thing after that is I'm going to put on my PPE. So the first thing I put on is my gown, then my mask, my goggles, and then my gloves. Put this on. Okay, so now I have my gloves on, I'm going to move on to auscultating the patient. Okay, so while I'm auscultating, I'm going to look for anything that would lead signs and symptoms of upper and lower respiratory obstructions that would lead to me doing suction. And for those things would be adventitious breath sounds, when the patient coughs and can't clear the secretions, when they're restless, and also a decreased respiratory rate. I'm going to take this real quick. Down back. I'm going to privacy while I'm checking respiratory rate. Okay. So after that, I'm going to put the pulse oximeter on their finger. Okay, and so I'm going to check vital signs and respiratory rate, looking for signs of hypoxia and hypoxemia. So the 4 signs that I would look for, or that I could look for, is decreased pulse ox rate, if they're anxious or fearful, and if they're pallor or cyanotic, and also if they have an increased pulse or heart rate. Okay, so after that, I'm going to put this here. I'm going to place the towel on my patient's chest. And I'll get these down. Okay, and now I'm going to move on to suction care. So before I do the suction care, I'm going to turn on my oxygen and my suction. I'm going to turn my suction on to 100 to 150, careful not to exceed 180. And then I'm going to turn my oxygen on to 100%. So I'm going to get this right next to the bed. Okay. So now I'm going to open my suction catheter kit. And I'm going to take off my gloves and perform hand hygiene. And now I'm going to don my sterile gloves. once I have these on, I'm going to fix my finger, and I have them on correctly. So the first thing I'm going to do is I'm going to reach in and grab my saline. I'm going to check the expiration date on it, and it is good. So I'm going to open it up. I'm going to throw the top away. I'm going to place it in my kit, not touching the sides, and also picking up my tube. I'm going to look at my tube real quick, make sure there's no kinks or any cuts in it that would cause me not to be able to use it. Okay, and I'm going to put my dominant hand on the number side, and then my other hand on the suction part, and I'm going to wrap. Careful to leave room so I don't contaminate. I'm going to connect this. Okay, so now that I've got it connected, I'm going to lubricate the end also checking the suction to make sure it works correctly. So I'm going to hold it kind of taut. I'm going to dip it in, and I'm going to intermittent suck. That way I know that the suction is working correctly. Okay, so now that I have it wrapped up, I'm going to take the oxygen off, and I'm going to provide hyperoxygenation. I would give them 5 to 6 breaths at 30-second intervals. Okay, so now that I've done that, I'm able to go in with my catheter. So I'm going to take the catheter and hold it taut. I'm not going to suction when I put it in, but I'm going to leave a finger widths away from the ends. Careful not to touch the outer cannula. And put it all the way in. Until I feel resistance or the patient coughs, I'm going to pull back 1 centimeter. Okay, and after I do that, I'm going to suction and remove the catheter. And once I've done that, I'm going to clean it once again and wrap up and hyperoxygenate my patient. Okay, so after I've done that, I would usually wait 1 minute between suctions as well. So I'll do it again. Get resistance, I'm going to pull back 1 centimeter. And now I'm going to intermittent suction as I pull out, rotating. Okay. And now that I've done that, I'm going to clean the suction and hyperoxygenate once again. Okay. So now that I've done my 2 passes, I'm going to put the oxygen back on. Okay, and usually when I am suctioning, I'm going to monitor his vital signs such as heart rate and the pulse ox. And if the oxygen saturation falls below 90 or 5% from baseline, I would stop suctioning, as well as the heart rate. If it changes 20 beats per minute, whether it's increased or decreased, I would stop suctioning as well. So I'm going to take this out. I'm going to throw this away in the trash can, as well as, so I'm going to take off my sterile gloves, glove to glove, skin to skin, and I would perform hand hygiene after taking that off as well. Okay, so the next thing I'm going to do is I'm going to apply a clean pair of gloves. So I'm going to acetate and compare for the first time I acetated. So I'm going to put this back and acetate. And I didn't hear any adventitious breath sounds, so I know that my suctioning was successful. Okay. And I also turned off my oxygen and suction after I completed that as well. Okay, so the next thing I'm going to do is I'm going to get my materials ready for care. And now I'm going to open my care kit, and I'm going to pull out the sterile field. Careful not to touch but the 1-inch border. Okay, so I'm going to lay it down. My glasses are fogging up, so I am going to touch them because I can't see. Okay, so I'm going to dump my container into there. Okay, and I'm going to look at my saline, check the expiration date once again, and it is in date. So I'm going to palm the label, pull that up. Also saline, so make it small. Okay, so I'm going to put that back. Okay, so sorry, I'm touching my goggles because they are fogging up and I cannot see. Okay, so I'm going to take out the inner cannula. Okay. Place the oxygen back, and I'm going to put it in the closest container next to me. Okay, and now I'm going to take off these gloves, throw them away. Now I'm going to open my sterile gloves. I'm going to put these on as well. Okay, so now that I have them on, I'm able to fix my fingers because I did mess them up when I put them on. Okay, and so I'm going to organize my materials on my sterile field. Careful not to cross it. Get these away from the 1-inch border. Okay, so the first thing I'm going to do after that is I'm going to pick up my cannula, bring it over my glove wrapper, and grab my squeegee or my sponge. I'm going to clean the outside as well as cleaning the inside. And then after that, I'm going to throw this away. I'm going to place it back in the same container. Now I'm going to grab a sponge. That's my gauze. I'm going to grab a sponge. And I'm going to dry my cannula. Into this. I'm going to dry the outside and hold it with the gauze and grab my pipe cleaners and go on the inside and clean the inside. Okay, so I'm going to throw that away. Now that I have the inner cannula clean, I'm going to take it and I'm going to put it back on the patient. So I'm going to place it in 9 o'clock and turn it 6 or 3 o'clock. Okay. Then after I do that, I'm going to place the oxygen back on, and I'm no longer sterile because that is the last sterile part of the sterile procedure. Okay. And so the next thing I'm going to do is I'm going to clean around the stoma. So I would take the oxygen off once again. I'm going to grab a Q-tip. Now wet it in the 3rd section. Take it over here. And I'm going to clean inner to outer in a rainbow motion, 2 to 4 inches in both directions. Okay, so throw that one away. I'll grab another one for the bottom. Again, inner to outer. To 4 inches. And I'm also going to clean the faceplate. So I'm going to grab another one. Clean it in a rainbow shape. And I'm also going to grab one more and clean the other side of the faceplate. And the last Q-tip I'm going to use is just to get under the faceplate because I forgot what it was. I'm going to grab it. I'm just going to. So now I'm done with cleaning. I'm going to grab a piece of gauze and I'm going to poof it and I'm going to pat dry. Careful to hold the faceplate down. Okay, so now I've patted dry. I'm going to throw that away. So now I'm able to put on I would also remove the old trach gauze pad when I was cleaning as well. And now I'm going to put on the trach tie. I'm going to put it on this side. I'm going to go through on this side, that way I can come around her other side. Okay, so now that I have it, I'm going to make sure one side is a little bit longer than the other. I'm going to come around the back of the neck. And I would double knot to tie it. Careful to avoid the carotid artery. I would put one finger under and it would be loose, and 2 fingers would be snug. And I would not take off the first trach tie until I have tied the second one. That way there's no chance of the trach coming out of the patient's throat. Okay, so the next thing I'm going to do is I'm going to put this pad on. Okay, so now that it is on, I'm going to replace the oxygen. I'm going to throw all my materials away. Okay, I'm going to take my gloves off and perform hand hygiene after I take those gloves off once again. Okay, and I'm going to put on one more pair of gloves. My hands are starting to be a little harder to put on. Going on. My hands are sweaty, that's fine. Okay, I'm going to pretend like they're on all the way, and I'm going to auscultate once more